Hello, this is Dr. Eduardo D'Alessandro from São Paulo, Brazil. We are currently on a break from the PPCR 2021, and we are supposed to focus on our group project. But today we'll have a video comment for our bonus assignment for this, and I will comment on an article related to my area, which is internal medicine and perioperative risk management. So the paper I selected is titled Efficacy of Self-Heating Cough Sleeves for Preventing Deep Vein Thrombosis in Lung Cancer Patients who undergo video-assisted thoracoscopic surgery, lobectomy. Well, this is from the researchers from China, Shanghai. They're named Shanghua Shan, Wenwen Xu, Saiqi Song, Xiaoshun Wang. They are at the Department of Operating Room, Shanghai Pulmonary Hospital, Tongji University School of Medicine, Shanghai, China. And it was published at the Annals of Palliative Medicine in 2020, the volume 9, issue 5, pages 2693 until 98. So, deep vein thrombosis, DVT, is a life-threatening condition, and among lung cancer patients who undergo surgery, its prevalence is estimated at 16%. Well, the research question this paper set out to answer was about the efficacy of a new prophylaxis device, a self-heating cough sleeve, capable of maintaining an even temperature of about 38 degrees Celsius and deemed to prevent stasis of blood flow and they were testing it in the actual prevention of DVT in lung cancer patients who underwent lung resection by video-assisted thoracoscopic surgery, VATS. Well, the diagnosis of DVT is usually based on clinical presentation, D-dimer plasma levels, and Doppler ultrasonography. The authors claim that the compliance with traditional non-pharmacological strategies for DVT prophylaxis is far from ideal, justifying the search for a new device which could address the problem. This was a randomized parallel study with two arms, which enrolled 557 consecutive lung cancer patients who underwent VATS lobectomy between June 2018 until June 2019. The subjects should not receive any chemical thromboprophylaxis, and in the intervention arm, the self-heating cough sleeve device was applied to both legs of the subjects between anesthesia induction and patient positioning. Both groups received routine nursing measures and performed preoperatively and post-operatively foot and ankle exercises. The outcome measures were color Doppler ultrasonography, D-dimer, and blood flow in the lower limbs. They took 3 measurements, and the mean of such measurements was used for analysis of the blood flow. So the primary outcome was DVT detected by ultrasound on postoperative day 2. Well, the statistic analysis, the sample size. The authors claim that they have calculated the size based on the assumption that without prophylaxis, about 16% of the patients developed DVT, and that 5% of patients using the new device would develop DVT. This calculation assumed an alpha value of 5% and a power of 80%, and was performed by chi-squared test. Well, when we recalculate the sample size with these parameters, we can see here, if we go for statistics and we go for power, precision, and sample size, the outcome is binary. And we're going to go for the chi-squared test, chi-squared. So we want the total sample size, 5% alpha, 80% power. We go for 16% on the control, the proportion, and 5% on the experimental. And it's a two-sided test. So when we go for it, we can see that the estimated sample size would be of 242, and they went all the way until 557 subjects were enrolled. So the patient's baseline characteristics were analyzed and tested for normal distribution. Continuous variables were expressed as means and standard deviation, and categorical variables were expressed as counts and proportions. Differences in categorical and continuous variables were compared by students' t-test and the chi-squared test, and all reported p-values were two-tailed. So they selected adequate tests for their hypothesis testing. The differences in categorical values were tested through the chi-squared, and continuous variables through student t-tests. So when we get to see the table one, here we have it. They present with counts and of male, female, the age is a continuous variable, so they present on a mean with standard deviation. Also the body mass index, the same, mean and standard deviations. Smoking is categorical, so they present as counts and proportions and so on. So it's quite adequate. We can see here that there's no significant difference between the intervention and the control group. And when we go for the results of the Dvt incidents, we can see, as predicted, the control group had about 15% Dvt incidence, while the new intervention presented about 4.2% of Dvt incidence. And the odds ratio here, we can see that it's protective, 75% less incidence of Dvt. They also present the secondary outcomes. They found significant differences in the flow velocity of the blood flow in the lower limbs. So pre-operation, we see no difference between the intervention group and the control group. both the maximal velocity and the minimal velocity. But in the post-operation scenario, we can see differences between the groups, with the control group presenting lower velocities, slower blood flow in the lower limbs compared to the intervention group. And this was a student t-test. It's a continuous variable. They could not find differences in the plasma D-dimer concentration, probably because it's cancer and surgery. So they both tend to increase D-dimer by itself, with no need to have a DVT. And they present us with a graphical it's easier for you to have a graphical analysis. Here we see the intervention arm and the control arm. They're quite similar pre-operation, and they remain quite similar on post-operation, although there is an increase between pre and post-operation within the groups, but among the groups we can see no difference here. So it was a very elegant paper study. They performed a very clean statistical analysis and quite adequate indeed. So I hope you enjoyed this quick presentation, and I hope to see you very soon. Okay, bye-bye.